Only the people can liberate themselves from
HIV and AIDS epidemic.
It is a fact that sub-Saharan Africa is the region most affected by HIV and AIDS. In South Africa, HIV and AIDS is a noticeable health concern. The total number of persons living with HIV in South Africa increased from an estimated 4.72 million in 2002 to 7.3 million by 2016. For 2015, an estimated 12.7% of the total population was HIV positive. Chisanya et al. 2012 estimated the HIV prevalence for 2012 by 12.2%. Approximately 1/5 of South African women in their reproductive ages are HIV positive. HIV prevalence among the youth aged 15 to 24 has declined over time from 7.6% in 2002 to 5.6% in 2016. The rate at which the population in South Africa is being infected is declining year on year from 1.77% in 2002 to 1.27% in 2016. South Africa's National Strategic Plan 2012 to 2016 identifies a number of key affected populations that are at risk of HIV transmissions. In 2015, about 380,000 new HIV infections were reported, with the highest incidence occurring among adolescents, young women and girls, sex workers, men who have sex with men, and children and orphans. Seeing that the number of new infections is increasing, Humana People-to-People South Africa initiated an intervention, Total Control of the Epidemic, largely known as TCE. That does not only help to reduce the number of new HIV infections, but that also helps the country to realize its 2030 vision. Funded by the USAID in partnership with the Foundation for Professional Development, the main goal for TCE is to make sure that people understand the importance of knowing their HIV and TB status through testing for HIV and being screened for TB and non-communicable diseases. This intervention was initiated with the aim to mobilize and support the people to take control of AIDS, the epidemic, and TB. TCE equips individuals with the facts and tools they need to take action and mitigate the consequences of the HIV and related diseases, break down the stigma that still surrounds the epidemic, as well as stopping the spread of HIV. It aims to contribute to reduce HIV incidence by linking high-incident communities and key populations to HIV and TB prevention, treatment care, and support services.
Humana People-to-People has the TCE program, the community-based counseling and testing. So the program has 5 modalities which we tackle with. The first main one is the SHBT, which means systematic home-based testing. And we have workplaces where we test people on workplaces. Then we have also the Twilight program, where we target the most at-risk population. We call it the key populations, the lesbians and the gays community. It is normally done at night, where we put mobile tents. Then we have the index patient, whereby someone who's HIV positive and someone who's on TB treatment invites our field officers to come and test at home, whereby the person consents to say, come and test my family members. Then the field officer goes and tests the family members. That's index patient. Then we have all the last one, the first things first, whereby we test on TVET colleges, government and non-government colleges, where we test on invitation.
CBCT is implemented in Govan Mbeki local municipality in Mpumalanga, eThekwini in KwaZulu-Natal, Buffalo City in Eastern Cape, Mopani in Limpopo, and in Free State. The project targets key populations identified as sex workers, men who have sex with men, migrant workers, people who inject themselves with drugs, and communities with high incidence of HIV. In 2016, key activities for the TC project included the establishment of a standardized referral and tracking system, community-based counseling and testing services, as well as strengthening community health systems to facilitate the scaling up activities.
Humana came in and they assisted the DOH in ensuring that we upscale the testing rate within our sub-district, because that is the only tool that you can use to see if we can manage the HIV and AIDS pandemic. And I think they have done a very great deal of influence in that initially our testing rate was very low, we could not reach our targets. But now at least we are moving towards reaching our targets. And that has also increased the number of clients that are on HEART program, basically because of the testing rate that has increased.
Another program implemented by Humana People to People South Africa is the DREAMS Initiative for Adolescent Girls and Young Women. The main focus of the program is to empower the adolescent girls and young women to prevent HIV through HIV testing services and condom promotion and provision. The program also focuses on reducing the risk of male sex partners of adolescent girls and young women in contracting and spreading HIV through HIV testing services and condom promotion and provision. This also done through strengthening linkages, and referral remain one of our top priorities.
We are doing DREAMS program whereby we do door-to-door testing adolescent young girls and women at the age of 20 to 24. We are also testing MSP, which are male sexual partners, at the age of 20 to 49 years. And we also do other age groups, which are 50 plus males and females. And after testing them, we are also linking them to treatment and care into their clinics, where they are preferring to go and take their treatment.
Both programs delivers services to key populations such as young women and girls, adolescents, sex workers, and truck drivers. This targeting is expected to contribute to a reduction in the number of new HIV infections, as well as improvement in the level of care and treatment being accessed by those in need. TCE has also contributed to the wellness and personal development among those living with HIV and TB. Humana People to People's contribution in achieving 90-90-90 is attained through support from field officers and the community as a whole. Lastly, TCE has played a key role in ensuring collaboration among various stakeholders in the communities in which it operates. This has directly resulted in community members being able to access additional services from the projects and their stakeholders. TCE is founded on the philosophy that only the people can liberate themselves from AIDS, the epidemic. And by equipping them with knowledge, Humana People to People South Africa believes that people can be in control of the epidemic. Humana People to People would like to thank the dedicated TCE leadership, TCE field officers led by TCE troop commanders and special forces, as they have taken their tasks to heart. Lastly, we would like to extend our gratitude to our partners, USAID, Foundation for Professional Development, FHI 360, Department of Health in districts in the provinces and on the national level, to their valuable contribution to the fight against the HIV/AIDS epidemic.